is day 2 for your Osce. You've already finished your MCQ, MEQ, and EBM Osce. We are left with Osce day 1 and Osce day 2. Now, what are the things are going to be on Osce day 1? I've already told you before, but I repeat because some students are asking me repeatedly that what's going to be on day 1 and day 2. According to the blueprint and the skill list you have, on day 1, we are going to have anatomy, histology, and pathology stations. So in total, we are going to have 5 stations. Station 1, 2, 3, 4, and 5. Now, station 1 and 2, they are anatomy, anatomy 1 and anatomy 2. In station 1, you will have upper GIT and radiology, and it's going to be 3 minutes only. In the same room, you have station 2, that is going to be the lower GIT and radiology, again 3 minutes. So one student will be entering the room number 1, where they're going to be 2 stations, station 1 and station 2. So total time will be for each station is 3 minutes. So you finish station 1, 3 minutes, and then you move to the station 2 in 3 minutes. So in one room, you are going to finish these 2 stations, station 1 and station 2. Then after that, you will move to the rests. And after this rest is going to be 6 minutes. Then after that, you will move to another station, that is station 3. Again, this is anatomy. This is urinary system and radiology. This urinary system also include the anatomy of the posterior abdominal wall, the structure in the posterior abdominal wall, as per your skill list and the blueprint. Now, this station, station 3 of anatomy, is going to be only for 3 minutes. And then next 3 minutes, you are going to stay in the room, and that is going to be the rest again. This rest is now for 3 minutes only. In the same room, you will be staying there with the examiner, but you're not allowed to ask anything with the examiner. Please make sure that you are in the rest for 3 minutes. 3 minutes only will be given to you to finish the station. After you finish with the station 3, you will move to the next room, and in the next room, you're going to have a station 4 and 5. The station 4 is histology and station 5 is pathology. Again, histology is for 3 minutes and pathology is going to be for 3 minutes again. Then again, there'll be 2 rest. So in total, there'll be 3 rooms and 2 rest stations. Each room is going to be 6 minutes. So for example, this is room number 1. In this room, you are having 2 stations, station 1 and 2 for 3 minutes. So 6 minutes in this room. From here, you move to another place that is going to be 6 minutes rest. Then again, you move to another room that is going to be 1 station only and 3 minutes rest. From here, you move to another room having 2 stations, that is histology and pathology, each room for I beg your pardon, each station for 3 minutes. And this is the third room. Again, you will move to the rest that is going to be 6 minutes. So in each panel, we are having 5 students. 2 will go to the rest and 3 will go to the rooms. Got it? So 1 student enter in this station, this room number 1. 1 station will be in the rest. Another student will be in this room. Another will be here, and another will be sitting here. So these two are for the rest, and then these 3 are for your stations. In the room number 1, you have 2 stations. In room number 2, you have only 1 stations, but you will not come out of this room. You will stay in the room for next 3 minutes, where you will not allow to speak to the examiner. Once this finish, and 6 minutes, and then you will come to the next station. So rooms are 6 minutes, 6 minutes here for 2 stations, 6 minutes here for 2 stations, 6 minutes here also, but 3 minutes is for the station, and 3 minutes you are going to take a rest. So this is on day 1. Now, what do you expect in the exam? This has been told to you. There you have a blueprint, you have the skill list, you have your workbook, lectures, everything. So you have to answer.
دكتور the voice is not
Okay,
clear.
fine. Is it clear now?
Yes.
Okay, you can see my screen.
Yeah, we can see it.
Yeah. So what do you expect in the station one and station two? This is pure anatomy and radiology, upper GIT with the lower GIT. You will get some models, or you will get the picture. Picture will be the clear. It will be color picture, and then you have to answer according to this. So you have some skill, and then there might be some follow-up questions. So they'll ask you, what nerve is this? Say, I'm giving you one example, like they'll ask you to identify the nerves or the structure, and then there'll be follow-up questions. It supplies what is the origin, or something like that. They'll ask you about some muscles. They'll ask you to identify the muscle, and then there'll be follow-up questions about that structure, or that could be the artery, vein, muscle, nerves, etc. Radiology question will be there, and mostly they'll ask you to identify the structure in the radiology. There might be some follow-up questions like uh, what is this radiology is. Uh, so what kind of imaging is this, or what structure you can see in this imaging? So you have to answer according to the instruction written over there, or the question asked by your examiner. So this is day one. In histology and pathology, again, you are going to get pictures. You will not get slides or some model, but you will get the pictures here. In histology, also picture, two, three pictures, and then you have to answer the questions, or there might be a follow-up question. So, like, so what is this? This picture is for which structure? And then there'll be some more question from that picture. There might be some follow-up questions. For histology and pathology, you will get the pathology, like say, what is this pathology is, you will get the picture, and you have to answer the question there. There might be some follow-up questions from that picture. So one is your skill, and one maybe a follow-up questions based on your knowledge. So you will be asked to identify the structure, and then there might be some follow-up questions. So this is day one. Now, next, moving on to the day two, and this is your basic science with histology and pathology, and day two will be your clinical science. Let me go to the day two. Now, can you see this screen for day two?
It's still at day one, doctor.
Still at day one.
Yes.
Okay. Is it day two now, or still the day one?
Still at day one.
Day one. Let me share again. Okay. I think now you can see the day two.
Yes.
Okay. Yeah, fine. So we finish 5 station on day one, anatomy, 3 station with radiology, and one histology and one pathology. So altogether we finish 5 stations, and then we move to day two. Now, what are the stations going to be on day two? Two integrated examination stations. One is your anterolateral abdominal wall with liver and abdominal examination. Now, in anatomy, you have to answer question from anterolateral abdominal wall and the liver. In anterolateral abdominal wall, you might get the pictures mostly, and then there'll be a question from like the structure forming the anterolateral abdominal wall, the muscles, the artery, the nerves, and the different area of the anterolateral abdominal wall, uh, and their surgical or clinical importance, especially the areas like inguinal canal, what a structure you can see in the inguinal canal, how the inguinal canal is formed, and what passes through the inguinal canal, and so on. For this information, you can refer to the lecture of anterolateral abdominal wall. And I just want to make sure that you have two lecture. I just said it to one of the students that you have two lecture. Both of them have the same type of content regarding the anterolateral abdominal wall. But I prefer to you should refer both of these lecture, because you will have some pictures there. So just to identify the structure in the picture, it is you might get a good picture from one of the lectures. So content are the same, but just for your reference, you can go to both of these lecture. You'll get the picture from anything in the anterolateral abdominal wall, and then there will be follow-up questions. And apart from that, you'll have a lever. Now, lever, they'll give you the model or the picture. In that, you have to identify the different lobes, their peritoneum, their relations, and there might be some follow-up questions. So just remember that. And examination, uh, there'll be some instruction given to you what exactly you have to do in examination. If it is asked that please examine the abdomen, then you have to examine the abdomen in classical way, like you have to do, you have to introduce yourself, wash your hand, you have to do the inspection, palpation, application, auscultation, then close the session. Thank you, the patient. And for this station, for examination station, you will get the mannequin. So you know how to examine the abdomen in the mannequin. That is clear to you. So you'll get the mannequin both in the male and the female side. And please read the instruction. What I'm saying to you that you might get some component of it, like say you will get it, okay, you do this percussion. So you have to know how to do the percussion. Or if it is just asked that examine the abdomen of this patient, so you have to do all the examination. So please look for the instruction which is given to you in the exam or as asked by the examiner. There might be some follow-up questions by the examiner. So that might not be written in your instruction. The examiner will ask you, and then you have to answer while you are examining the patient. And you have to follow the classical the pathway of examinations as per your guideline that has been taught to you or that has been written in your ECE logbook, how to examine the abdominal wall. So you know about it. So you need to wash your hands. So you have to show the examiner that I would like to wash my hand, and then I'll ask the patient, take the consent. This you all know. I'm not going to teach you about that, how to do this, but I'm just reminding you that you have to follow the classical pathway. Sometimes it happens that you did it in the right way, but you missed some steps. You did it very nicely, but you missed some step. And these the marking is based on their steps, whether you took the permission. I'm giving you some example. You took the permission, you wash your hand, then you close the session, thank you the patient. So these are the steps as given in your ECE logbook. So you have to follow this. So this, please remember that you stick to the steps given in the your logbook, and you perform it accordingly to that. So once you move from station 6 to 7, there'll be another integrated stations, and this station is about what? This is about the thyroid examination, and then anatomy of the thyroid, endocrine structures like anatomy of the thyroid, the pancreas, the adrenal, and then the thyroid examination. Again, you will get the mannequin. You have to perform the examination on the mannequin. How to do the examination of thyroid, you know about it. Remember every steps, don't forget it. Even if you do it well, but you miss some step, you will miss the marks. So please make sure that you are following all the steps of the examination. And for these stations, you will get the 6 minutes. Then you move to the rest. And this rest is again 6 minutes. Beg your pardon, here it is written 8 minutes, but it is 6 minutes. And then we have two consultation stations, consultation 1 and consultation 2. Now, in these consultation stations, again, they're of 6 minutes, and you'll only be asked to take history from the examiners. So there'll be no prescription writing, just history taking, 6 minutes for each. One is, as per your blueprint, GIT and genitourinary or endocrine. So you have to take history, what based on the complaint of the patients. So follow all the steps. This is a very good stations, very high scoring stations. But if you miss some steps, then you will miss the marks. So please stick to the full Clargy framework, Clargy Cambridge framework, and then ask the question according to that. So these two again are of 6 minutes each. So in each panel, we'll have 5 students, 4 will go to the stations, 1 will be sitting in the rest. That is of 6 minutes. So this is day 2. So we finished day 1 and day 2, and then, that's all for you. and we finish this module, inshallah, of nutrition and metabolism. Now, how to come? This has been already, given to you that the instruction how to come. You have to wear your white coat. You have to bring your ID card. You can bring the stethoscope if it is required. You just bring it, the stethoscope, if you have it, or otherwise we'll provide it. No problem for that. And you are not allowed to leave until we ask you to leave. Don't go anywhere. Don't talk to anybody. Don't talk on mobile phones. If you are like, you finished the exam and you are allowed to, you are set to sit on somewhere. Don't go outside and don't talk to anybody on the mobile phones or something like that. So please just stick to these instructions. And I wish you all the best for your coming OSCE exam on day one and day two, inshallah. Now, if you have any questions, you can ask me, or I don't
Doctor,
want to take your much time. Yes.
would you kindly send the two lectures of the anterior lateral abdominal wall?
Yeah, this was asked by one of the students, and I told her or told him that the content are the same. I'll share with you that they are same like same thing about the different muscle, everything, but I'll share again with you what are these. One is actually available at the platform, one is shared by Dr. Naveen. So don't worry about that. I'll share again with you what are these two lectures are.
Thank you.
Okay. Any questions? So don't take too much stress. These exams are going to be easy exams. So don't worry about that. I know this. You can answer all these questions. Be relaxed, have a good sleep, and come and enjoy the exam. These are easy exams. The difficult exam you finish your MCQ, MEQ. This is, you just come and enjoy, and that's all. It's not going to be, don't need to take any pressure on that. If you take pressure, you will not sleep well. You will not be answered to, able to answer the question. You need to vocalize. You need to speak out. You need to speak the questions. You need to listen to the questions. And if you like have some problem in reading, just ask the examiner, could you read it for me, because each station is 3 minutes on day one and 6 minutes. So if you want to take help, you can ask the examiner that could you read the question for me, or is there any problem, you can just ask. And the organizers will be there. If you need any help, you can ask the organizer immediately that you have a problem. And the student list is sent to you. You know your list. You are going to and which cycle, which panel. So please make sure that you are going to the same panel. And that's all. Okay. If you
Doctor, I
have
have
any
a question.
questions, if you want to, yeah, please.
About the consultation stations, is there going to be any prescribing or not?
I told you this is consultation only. You have to take the history from the patient.
Okay, thank you.
Welcome.
Doctor, for the consultation, we are not required to do any examination, right?
I know that on day one, I couldn't get your question. Could you repeat your question?
We're not required to do any examination, just taking the history for the consultation sessions.
Consultation is, yeah, consultation is history. It's history. You have to take the history according to the framework which you know about that. How to take the history. This you are doing it from all the cases, case 1 to case 9 is all about the history, how to take the history. Please remember, don't miss any points. If you miss like patient perspective, you miss the point. You said that doctor, I was perfect, I asked everything, but actually you missed some important point. You didn't thank you the patient, you didn't take the consent of the patient. Doctor will not tell you that you missed this, right? Or you will ask the doctor, doctor, did I miss? Doctor is not going to tell that you are missed the patient perspective, your idea, concern, expectation. You missed the saying thank you to the patient. You didn't take the consent. Doctors are not going to tell you that you missed this point. When you ask the doctor, doctor, did I miss anything? How could you expect the doctor to tell you that you missed these points? If the doctor tell you is not right, he or she is not right. He or she should not let you know that you missed these points. What is this point is? You should know all these things that okay, we as a student are supposed to know all these points. And need to take the history like this way. Okay, and